Yesterday I had my consultation at Bristol's French Hay Hospital for laser hair removal for my donor site for Phalloplasty. So I thought I'd tell you about that. The reason I'm based in Oxford and yet I went to Bristol is because I'm under the care of the Laurel's Gender Identity Clinic in Exeter, and so their catchment area of where they can fund is probably different than if you're based elsewhere. So they gave me a list of places that I could go to access NHS laser hair removal, and Bristol was the closest to me and the cheapest, so I went with that. I was referred by my therapist. I think there seems to be differences in how this happens, because I've not had my official referral for phalloplasty as yet, but I've already been referred for laser hair removal, and that makes sense because you do need to get a good chunk of time in before your surgery to get the hair removed. I think this is a strange topic at the moment that just seems to differ from gender identity clinic and differ from surgeons, because it needs to be that the surgeon says to you that you need the hair removed in order for it to be funded. Because what it is, it's particularly this strip here that needs to be hair free, because although the whole site around the forearm is used to create the phallus, it's this part here that makes the urethral tube, and that needs to be hair free, because otherwise hairs can get in growing and cause problems if they start growing in the tube where your pee's flowing through, obviously. So they like that part hair free, but a lot of people haven't got that much hair underneath on their arm palms, so Mr. Christopher, other surgeons sometimes say it's not needed. So that can sway whether you get NHS funding for hair removal or not. Now, when I saw Mr. Christopher for the kind of off the books kind of chat about phalloplasty, he said to me then that I would need some hair removal because I have got hair under there and I've got incredibly hairy arms, so it would be sensible to get some done before surgery went ahead. So because of that, my clinic was able to refer me even before I've had the official referral with him. It will vary, I expect, from gender identity clinic to gender identity clinic, but I would always say push for your case, because hair can cause infections. If you are hair free, it's going to be so much easier, and it's going to be easier than trying to get hair removed from your penis post surgery. You know, you don't want to be going through that as well, especially because you're going to have to wait until your penis is, we're going to either have to do it at the beginning when it's still a bit numb, or risk doing it later on when it's going to be excruciatingly painful. So I think if you can get some done beforehand, just push with your clinic. That would be my advice. Thank God for the Laurels. They are great, understanding, and really good at this stuff. So I'm very, very lucky to be with the Laurels. So, okay, yes, my appointment yesterday. I actually did think it was just a consultation. But it wasn't just a consultation. They did a little patch of hair as well, which is good because, you know, I like to know how this thing feels. It was lucky I did a picture beforehand. I'll put that at the end of this. I'll show, and I'll keep pictures all the way through. I'll show a before and after, before my appointment, the morning, before yesterday morning, and then straight after the hair removal. Basically, she wanted to do a test patch because I have self-harm scarring here, and also because I'm tanned. She wanted to see how it would work with my skin, because ideally you need to have no tan. The reason for that is, if I can explain this, the hair works on light pulses, so it needs contrast. So ideally it works best on lily white skin with really dark hair, so that when the light pulses hit, it can differentiate between the skin and the hair and kill off the hair. And obviously if your hair colour is similar to your skin colour, it's not going to be able to tell the difference. So the paler I can get my skin, the better, because my hair is fairly dark. So I just need my skin as light as possible. So now for the next 4 weeks, whatever, throughout the whole of this laser hair removal, I'll be covering my arm up with something. I've got a stretch bandage, and I've actually started buying some sleeves for post-fallow anyway that are kind of skin coloured, can go on my arm, so I'll use them. So yeah, the lady was really lovely, really understanding, really sensitive, really brilliant. The lady that actually carried out the hair removal was good too. She was very funny and very understanding. It does hurt, I'm not gonna lie. It's not comfortable. It feels a little bit like having a tattoo, but probably not as bad. Do you remember those cooker lighters? I think you can still get them. They're just like this button you press to light a gas cooker, and it's like a little electric thing inside. Well, when I was a kid, you stick your finger in them for fun, as you do, don't ask. It feels a little bit like that, but more pinpricky. So when she was just doing like one, it was sharp but okay. But when she does like a patch, so she runs it over for like a few seconds, it starts to increase, and it's a bit like, ooh. But in short bursts, it's certainly manageable. It's not something I'm too bothered about, so it's fine. In terms of how your skin reacts to it, it differs with people. Some people will have a little bit of redness and it will go, and other people will be pink for days and they might get blotchy and what have you. I, within a few hours, had gone from bright pink straight afterwards to pretty much back to normal. I've got a few little spotty bits. This you can't really see, I don't expect. But yeah, I seem to deal with it very well, so that's really, really good. So I'm booked in again for a month's time, and we're going to get this show on the road. In terms of success of it, I think I've mentioned this before, that I wondered why the FDA approves electrolysis as a complete method of hair removal, but not laser, because apparently laser minimalises and makes the hair finer, but doesn't always get rid of it, whereas electrolysis does. Obviously electrolysis is a much longer process. And the lady explained that the reason it's funded by the NHS is because hospitals tend to have the laser hair removal going on, and beauty salons tend to have the electrolysis going on. So that's why the NHS funds laser, but not electrolysis. That's why. But certainly if I had electrolysis, I'd probably have to leave a good year between now and phalloplasty to get it kind of hair free. So what she said with me is that over the next few months between now and hopefully late February, if I'm going to have my surgery around then, she should be able to at least minimalise it. It does depend on the person. Some people, the hair is really resilient, it keeps coming, and other people, after a first treatment, it never comes back. It all depends. So she's confident though, between now and then she'll be able to minimalise it, which is fantastic, because I mainly just want to make sure it doesn't cause any complications in my surgery, and that when it does grow back, it's minimalised enough that it's then easier if I need to go for some hair removal on my winky. Which isn't a pleasant thought, but it sounds like they do that as well. In terms of the amount of funding, we don't know that. The lady looked at the letter yesterday and said mainly in trans ladies, when they're referred, it will say how many sessions, but with mine it just says I'm referring this patient for laser hair removal. It doesn't say how long, so let's just hope that it will cover me from now until my op and just be ongoing. Don't know. And as to whether you get any afterwards in terms of funding, I don't know. But I've got some options for that later on, if needs be. But we'll cross that bridge when it comes to it. So yeah, that's it for now really. All in all, French Hospital, great staff, great approach, really kind of easy to get to, and yeah, straightforward. Laser hair removal itself, not too bad. It's alright. And did I mention I need to get a template? Does anyone have a template? I know it's about 14 centimetres, but I'd like, because I know it's kind of like at a funny angle, and I can't find a template anywhere, and what I need to do next time is mark out the area by shaving, because they like you to just have a little tiny bit of stubble on your arm, so if I mark out the area with stubble, she'll know where to go. So I'm kind of winging in the dark at the moment exactly what to get rid of. So if anyone does have a template, that would be really appreciated. And if anybody needs any more information that I haven't mentioned, or I can help, then please give me a shout, and I will update very soon. Take care. Bye bye.